Dr. Parker here. So with cold and flu season upon us, I thought this would be a good time to talk about how we can treat colds at home. Colds are very, very common, and it can feel like your kindergartner has a runny nose from September all the way through March. So what can we do to treat these symptoms at home and get them feeling better? So there's a lot of good things that we can do for them at home. If they have a cough, if they're under the age of 6, I recommend just plain honey. You can do about a teaspoon of honey, and that can help loosen the mucus and help with that cough. And we actually have evidence that shows that the honey may be better than the over-the-counter cough medicines for treating the cough. If they are under 6, I generally don't recommend cough medicine unless your provider has specifically recommended that to you. If they are over 6, those cough medicines are usually safe to use, but you want to make sure that you're following the instructions on the packaging so that they're getting the right dose. Other symptoms that are really common with colds are runny nose, congestion. So if they have a runny nose, you can use bulb suction to help clear that out. Or if they're old enough, you can help them blow their nose. If they're really congested, you can use saline or saltwater drops, and you can put that in the nose, and that helps soften things up, loosen it up so that it's easier to either suction out or easier for them to blow. And the other thing that you want to make sure of is that they're staying really well hydrated. So you want to encourage lots of liquids. That helps thin out the mucus, so it's easier for them to cough it up, easier for them to blow their nose. You can also use a humidifier, and that helps keep the nasal passages and the airways from drying out. And if you don't have a humidifier, you can have them sit in the bathroom while a warm shower is running, and the steam can be really helpful. So what do we do about fevers? Fevers can be treated with Tylenol or ibuprofen. We shouldn't use ibuprofen in anybody under the age of 6 months, though. Now, not every fever necessarily needs to be treated. The fever does serve a purpose in fighting the infection. So I usually recommend not treating it unless the fever is like 102 or higher, or if your child is really uncomfortable. So if your fever is 101 and you're reasonably comfortable, you don't necessarily have to treat that. Lastly, if you are not feeling well, and especially if you have a fever, I recommend staying home and giving yourself time to get better. And if you have any questions, always feel free to contact your provider. Thank you.